Hi there, and thanks for joining. I'm Bronwyn Radcliffe, and we are going to talk today about how you get sick and how I treat it. So, I'm the owner and founder of the Colorado Center for Lifestyle Medicine and a board certified nurse practitioner. I practice functional medicine using lifestyle modifications, mind body medicine, and coaching. All right, so the Colorado Center for Lifestyle Medicine is a primary care practice. We serve patients 1 to 100, and we offer, like I said, a functional medicine approach using lifestyle modifications to support your physical, mental, and emotional well-being. It is my belief that you are the expert in your own body, and we are just coaches and supporters. So this is your work, and we are likely to be one chapter in your healing, and I hope to be a good support system and be able to help you stay well if you're already well and get well if you need some help. So we are in the Colorado Rocky Mountains in Salida, Colorado, and we see people online and in person. We also offer coaching and mind-body medicine. We do accept insurance. So far, Medicare, Medicaid, Anthem, Blue Cross, Blue Shield, United Healthcare, and Cigna, and probably something else, I'm not sure. And then coaching and mind-body medicine are not typically covered by insurance. So for your physical health, we take a deep dive into who you are and what you want. What's your story? What do you do? What do you want for your physical and emotional health? And are you ready to take action? And if so, what kind of action are you ready to take? After we learn about your story and your goals, we will ask you to do some testing. Will be most likely some blood work, some saliva, stool, and urine testing. We may need radiology as well, depending on what's going on. So we are looking to assess your adrenal glands, your gastrointestinal tract, and then how your DNA is responding to your current lifestyle and your current environment. Mind-body medicine is a huge component of my practice, and it is, from the science standpoint, psychoneuroimmunology. It's the connection between thoughts, emotions, and how those untamed thoughts and unaddressed emotions, or the tamed ones, manifest as dis-ease, illness, or health. Mind-body medicine is an extremely powerful way in which you can heal yourself. Research demonstrates efficacy in the relief of depression, anxiety, transformation of trauma. People who complete the program and utilize the skills say that they feel lighter, they sleep better, they take better care of themselves, they have improved relationships, they experience less pain, take less medicine, and in general, they just feel better. Coaching is a great modality to help you understand how your thoughts create your emotions, how your emotions drive your behavior, and how that behavior creates what you see in your life. You'll learn how to shift your thoughts and emotions, take different actions to result in the life you desire, and it's about awareness. And it's about awareness of thoughts, emotions, and habitual action. You'll learn how to manage your mind, which is an ongoing process. I'm not going to say you're going to master it, but you are going to learn how to begin to take charge. And we do have several classes that we offer. You can check it out on our website at coloradolifestylemed.com under coaching. All right, so what is lifestyle medicine? Lifestyle medicine is a medical specialty that uses the therapeutic lifestyle interventions as primary modality to treat chronic conditions. Now, I say that as therapeutic lifestyle interventions, but basically it's just what we should be doing anyway. Getting outside, sleeping well, eating well, exercising well, not abusing the substances that taste and seem so good, like alcohol, drugs, sugar, etc. And it's about taking care of ourselves so that we can support our relationships. So those 6 main pillars of lifestyle medicine is a very healthy, whole food, plant predominant diet, appropriate physical activity, restorative sleep, stress management, avoidance of risky substances, and positive social connection. And lifestyle medicine is actually the foundation of conventional medicine, if you want to know the truth. And most of the guidelines in all aspects of clinical practice recommend that we use these lifestyle interventions first before we provide medication or surgery. All right, so at this Colorado Center for Lifestyle Medicine, we use all the tools to help you achieve your well-being goals. We will do testing, we will use supplements, and supplements are really, vitamins, minerals, herbs, etc., that support you until you get your lifestyle interventions into place and working for you. They're not meant to be forever, though I say that, and I do take a multivitamin every day, and I take fish oil every day, and I do take a couple of brain supplements every day. But mostly supplements are there to supplement you until you can get yourself together enough that your lifestyle, your diet, your exercise supports your well-being. Mind Body Medicine is a huge program. I highly encourage it and really want everyone to participate in it. Coaching also extremely important, and everyone should receive coaching. Meditation is an essential self-connection tool. Movement that suits you, your needs, and your body, your goals. Food that works for you. There's no one perfect diet. So understand that it's a dialing it in to what works for you. And then, of course, we use prescriptions as and if needed. All right, so let's talk about how you get sick. So there are 3 main ways that we get sick: the emotional, spiritual aspect of chronic stress, addiction, trauma, like brain injury, concussions, motor vehicle accidents, bodily injury, infection, abuse. And these, how you perceive an event rather than the event itself is really the major determining factor in generating a stress response. So diet is another way that we get sick. If we're eating that standard American diet, it's not very healthy and devoid of a lot of nutrition that your body needs to support itself. And that can then, it's overloaded in sugar, which is a huge problem. Nutrient deficiencies, food sensitivities develop. So that's a really big component. And eating a carbohydrate-rich or a standard American diet often leads to a rapid rise and fall of blood sugar that creates its own stress on the body, creating what we might call a hyporeactive or a reactive hypoglycemia. So we get a huge rise in blood sugar and then a very, very low dip, and then a rise and then a dip, and that creates all kind of hormonal dysregulation and eventually resulting in disease. Infection and inflammation is another way that we get sick. So toxins in our environment, there are thousands of them, and we're exposed to them on a daily basis. Heavy metals, molds, chemicals, structural infection or limitations. So we may get a broken arm or something, a broken leg, physical trauma, injury, poor posture, chronic pain. Surgery can be the beginning of an illness. Medications, the wrong medications, or medications that then deplete the body of some of its essential nutrients. Dental infections and dental problems, or just not having teeth or not having enough teeth can also be a problem. And then there are, of course, environmental components that affect our health as well. Then pathogens in the gut like worms, bacteria, fungi, parasites can also be hidden sources of inflammation and infection. So in summary, how we get sick is inflammation is generally where it starts. The body can go within itself to get the nutrients it needs when it's under extreme stress. And that means it can pull nutrients from bone, causing osteoporosis. It can use the amino acids from muscles and from the gut lining to support itself, meaning that we'll have reduced muscles and we'll begin the degradation of the gut. Insulin resistance shows up when the survival response floods the body with sugar. And when that becomes chronic, It can be a big issue. And then, of course, that oxidative stress resulting from damage and not having the nutrients and the nutrition to support the system, the body becomes overwhelmed, undernourished, and it can't keep up. So what's affected? Absolutely everything. You are unique. You are unique. You have biochemical individuality. You're different than me, even though we are human. But the human body is not an isolated system. And so everything is affected. The neuroendocrine system, so brain, hormone glands, and organs. The GI system, from the mouth to the anus. And then, of course, the liver and detoxification. Liver, gallbladder, pancreas are all involved in the inflammation and chronic disease process as well. So symptoms that we see are numerous. This is really hard to delineate here, but adrenal glands, thyroid, leaky gut, liver and detoxification, gallbladder, brain, nervous system, cardiovascular, the metabolic system, immune system, kidney, bladder, musculoskeletal, and hormones, male and female. And those symptoms are numerous. So the things that people complain about the most: fatigue, depression, insomnia, weight gain, irritability, mood swings, sensitive to everything, can't lose weight, my hormones are out of whack, I don't have a sex drive. I mean, it goes on and on and on. And so these are the main common symptoms that we see. How we test. I test the neuroendocrine system with a saliva test to look at the adrenal stress profile, and I use blood work for hormones and all kinds of other things to look at that, thyroid, etc. Use the GI map, which is a stool sample, to look for infection, overgrowth, imbalances, dysbiosis, intestinal markers that show inflammation, and let us know whether you have some allergies or gluten sensitivity. And I use an organic acids test, which is a urine test. Sometimes it includes a little blood and mucosal swab, but it's looking at how your DNA responds to the environment in which you live. And so organic acids are the end metabolism of carbohydrate, protein, fats, and it gives us a lot of information. Also gives us information on neurotransmitters and if your brain's inflamed and what's going on there, what the oxidative stress level is in your body, do you have toxins, etc. It's a very, very rich test. And so these are the main tests that I use, as well as, like I said, some blood, and then if we need it, radiologic imaging. How we treat? Well, we treat with where it started first. So we look for the underlying causes, evaluating those three major body systems, and we address physiologic damage, and we link your symptoms to what we find on the tests. And I always start by addressing the adrenals first, because if the neuroendocrine system is balanced and healthy, then it's much easier to put all the other pieces together. If it's not, then I can work for a long time on gut and detoxification and not get very far. It really matters that the neuroendocrine system is balanced first. And like I said, we use supplements to support you while you create the healthy habits that you need to sustain you. So I would say this is a partnership, and you are the expert in you. And I'm really just the guide. And to go from a place of discomfort to a place of ease requires change. And it may require giving up things you like, things that you find that support you in the moment but aren't good for you long term. And it means it needs you to open your mind, experiment, play a little. Let me know what's working, what's not working. And like I said before, I'm going to be one chapter in your book, in your journey, and there are going to be lots of other people who are going to help you get to where you want to be. But me and my team will guide you, support you, will teach you, We ask that you get coached. We ask that you take Mind Body Medicine program. We ask that you get involved, do the testing, and do the work that it takes, because that's when you'll see results. So pay attention to what's happening to you, what works and what doesn't work. You have a long history of things that don't work. And so now it's about finding the things that do work and maybe doing things differently. We ask you to eat well, exercise to your capacity, sleep well, go outside and play. Go outside every day. Meditate daily, avoid or limit alcohol, marijuana, and other mind-altering substances, and recognize that these are not super healthy. There's a time and a place for everything. So if you do your part, it works. And if you don't, it doesn't. All right. So if you'd like to become a patient, you can call us. You can get online, make an appointment. We'd love to hear from you. If you'd like to participate in coaching and mind body medicine programs, you can go to our website at coloradolifestylemed.com under Mind Body Medicine or under coaching and find some information. All right. Thanks for listening. We look forward to working with you.